I studied at Kyrgyz State Medical Academy, and at the same time, I after the sixth course, sorry, I started to work as an intern at the Department of Psychiatry and Psychosomatic Disorders at the National Mental Health Center in Bishkek. So then I actually I have been working there for 2 years, and what I noticed there, so I was trying with my colleagues actually to gain the experience and to try to help people, you know, to treat them, then to gain the professional skills and knowledges which I could use then, you know, in my career. But I was thinking that something is going wrong in this system, in this healthcare system or mental health care system. For instance, we have been treated people with outdated drugs and medicines. We have been using some, you know, outdated treatment schemes and techniques and approaches. So the conditions in our departments, not in all meaning, but, you know, in some cases were really poor. And I could say that the psychiatry, I mean, as an area, as a domain of healthcare system that time, was one of the unprioritized. And what happened to me at that time, I was thinking maybe I need to understand how I could change the situation from another angle. And then I have heard that there is an organization. The name of it was Thais Plus. It was working in the field of HIV prevention for marginalized groups. Particularly, it was working with sex workers and transgender people in Kyrgyzstan. And we started to work as a volunteers of harm reduction program, and which was funded by Open Society Foundation public health program. And that was my first experience when we started, how we started to work with OSF PHP. So we have been delivering the harm reduction services, as I said, in Bishkek and these suburban areas, but also we have established, like, first, let's say, we call them the points of help, let's say, in English, yeah. And that was one of the most exciting moments also in my life and the beginning of my journey with OSF PHP. Because that was the first time when I have seen actually this harm reduction, work on the grassroots level, not sitting at the, at the cabinet, not, hearing at the conferences, maybe the wonderful presentations, but, that was absolutely amazing, work with people, with humans, with the leaders of the community. And I remember then they showed us, how they are, were preparing the drugs actually, how they told us, a lot of stories about the violations of their rights from the police. They told us tons of stories about the, problems with getting access to essential treatment, essential medicines. Marine Boussonnier, our previous deputy director of OSF PHP, and then she moved to be head of PHP program at headquarters office. So she came to Kyrgyzstan together with Roxana Bonnell, and they both established with their team, together with our team, the new program on hepatitis C and access to essential treatment, by the way. And the main topic for this team was, the work on improving the access for diagnostics and treatment of hepatitis C in our region. Outside of the workshop, field, I mean, during the breakout sessions, during the, lunch, etc. Many people came to me and said very directly to me, "Oh, what are you doing? You are absolutely wrong. You are spending, let's say, this person said to me, he was from government actually. He said to me, you spent, you spent, let's say, $2,000 or $3,000 for this workshop. you invited us to talk about the theme which is absolutely, unrealistic in our country. So you are trying to raise the question of the treatment and diagnostic of hepatitis C in Kyrgyzstan without a deficit of the budget, without problems and holes in our system. I mean, which is already overstretched. Health system. And with with this current situation with the drugs, which cost 15,000 United States dollars per one, course, and in many regards, like the result of this course are really, also unguaranteed. So maybe 40 or 45%, according to the research, will be treated well. Others, will be unsuccessful because of the conditions of these drugs. And you could imagine in our low income country, as in Kyrgyzstan, I mean, $15,000, he said to me, it's absolutely unrealistic even for me. He said, I'm well equipped in terms of the finances, but still, if I would, be infected by hepatitis C, I would not afford to myself this treatment. So what are you talking about? It's absolutely, just wasting time, workshop. And I was really, really angry. That was a story when we were fighting during this, 3 days workshop in Isyku Lake. And actually, it was maybe first time in the story when we were all together, fighting in one line with the WHO office, with some MPs, with Ministry of Health, some people from Ministry of Health, etc. And the opposite side was, consisted of people from patent agency, from government, some lawyers, some pharma companies. And it was a, hugely, this movement, from opposite side was hugely supported from pharmaceutical companies, as we have heard. So then we convinced actually, and we brought a lot of media coverage during these events, we brought a lot of social media coverage. And we convinced at least 3 or 4 MPs who attended this workshop, because they were, neutral. They were actually leaning to the position of this, of the patent agency, saying something, oh no, we can't afford, these not branded drugs. They have bad quality, and also this patent law should be protected because of many reasons. Also, they had a really good argumentation from their side. So, but then when we convinced this, that let's say 4 or 5 neutral MPs, that was actually the final day of this workshop. Then just immediately, the changes started to happen in our country. It was a big movement and the big fight, and I could say that the main sign of the success of our story was actually the feedback from the community leaders and from this from people from this list who said to us, actually, you gained this achievement, and you now need to help us to now to do the budget advocacy work. So you need to convince our government now to develop and to adopt the new hepatitis C program, national one. You need to do advocacy work, and we will be with you, and we will advocate for this, plan and for these activities. And we need to convince our government to put funding, domestic funding, on procurement and supply of these drugs now. Most of the successful projects were based on the very few things. First, the leadership of the people, the grassroots level. And it doesn't matter if it's a Karabalta city near to the Bishkek, the small population. or it's a Bishkek, or it's New York project, harm reduction. It should be laid on the basement of the leadership of the people from communities. So it's first. Second, it's about the trust between the community leaders, between the organizations which is funding and supporting the, for instance, the field of harm reduction, or the field of, let's say, palliative care or sexual health and rights. It's a trust between the funding agency and people who are, sitting at this side, and between this community leaders and this movement of people who are fighting for their rights. And the third thing, which is also really crucial one, I think, it's all about the personal commitment and sometimes personal stories.